The future goals of the Department of Public Health in Plymouth is to do more work in the areas of social determinants of health. What exactly does that mean? We spoke with the town's first ever public health director to get an explanation.
Right now, the state of public health is in new territory. As we can see right now, or as I can see it, is that we're in a phase to where we're conducting inspections, we're responding to outbreaks. We're trying to understand how disease is being impacted in and across the town. And I got here in August with very limited information because typically most of our public health, local public health partners are operating on Paul Revere's model that was, almost 300 years ago. And so you have a lot of public health entities on the local level calling themselves boards of health. And typically they operate only as board of health. We're fortunate in Plymouth to have a Department of Health and a Board of Health. So that way we can really assess the state of public health from both the regulatory side and also looking at it from the public health practice side. One of our prime objectives is to look at disease surveillance. And that means that we get to look at all the infectious disease and even some chronic disease indicators across the entire town of Plymouth. And then another piece is that we get to evaluate and do some inspections for our food establishments, also look at some water quality issues in terms of our septic tanks and making sure that those practices are being adhered from our engineering community to build those safe types of vessels, if I may, to make sure that people's sewage is kept in check, and then we also do fats, oil, and grease regulations and enforcement, making sure our private haulers are doing what they're supposed to be doing for that type of enforcement too as well. It's really exciting from my perspective to be able to look at things from a very proactive standpoint when we talk about looking at disease in communities and how restaurants and the food quality and also the safety of the food may impact disease outcomes as well. And even water quality, correct? And air quality. I can keep going on. But the point is that from my position, I look at things systemically so that way we can determine who's at a greater risk and how can we mitigate that risk and what are we doing from the upstream level with our policy all the way down to the downstream level to who's getting impacted in various communities.